Episode 1 RVUs Explained, the system that influences physician income. Welcome to Medicine, Dollars, and Decisions, Life, Business, and Medicine. I'm Dr. Bruno Casanova. Today, we're starting with the basics. What RVUs are, why they matter, and how they influence physician income, even when you're paid a fixed salary. Let's start with a simple question. What if I told you that every office visit, every procedure, every surgery, and almost every patient interaction you have as a healthcare provider is assigned a numerical value by the federal government? That value is called an RVU. RVU stands for Relative Value Unit. Simply put, RVUs are the currency of modern medicine. They are one of the primary ways healthcare services are measured, compared, and ultimately reimbursed. Whether you realize it or not, RVUs influence how hospitals, medical groups, and physicians are compensated. Let's look at a simple example. Most office visits are assigned evaluation and management codes, or E/M codes. Some common examples are 99212, 99213, 99214, and 99215. A 99212 generally represents a straightforward visit with relatively low complexity. A 99215 represents a much more complex encounter, often involving multiple medical issues, extensive decision-making, and significantly more physician time. As of 2026, a 99212 is assigned approximately 0.7 RVUs, while a 99215 is assigned approximately 2.8 RVUs. Now, let's use simple math. If one RVU were worth $40, which is not far from what many physicians receive, then a 99212 visit would generate about $28, while a 99215 visit would generate about $112. The important point is not the exact dollar amount. The important point is that different services are assigned different RVU values, and those values influence reimbursement and compensation. And it goes far beyond office visits. Imagine you see a patient for a preventive visit, but during that same appointment, you also evaluate abdominal pain. Each service may receive its own code and its own RVU value. For surgeons, the concept is similar. In my specialty, if I perform a hysterectomy and a cystoscopy during the same operation, each procedure has its own CPT code and its own RVU value. In other words, healthcare services are broken down into individual components, and each component is assigned a value. Now, here's why this matters. Many physicians think RVUs only matter if they're on a productivity-based compensation model. That's not true. Even if you're paid a fixed salary, RVUs were likely used when your employer determined how much to offer you for this position. They influence physician contracts, compensation benchmarks, staffing decisions, departmental budgets, and even hiring strategies. Whether you're employed by a major academic center, a community hospital, or a private practice, RVUs affect your professional life. In fact, they may influence where you choose to practice, whether you pursue additional fellowship training, or even which specialties are considered more financially attractive than others. RVUs are everywhere in medicine. Most physicians just don't realize it. So, who decides all of this? The official RVU values are published by the Centers for Medicare and Medicaid Services, better known as CMS. But CMS doesn't work alone. Behind the scenes, another highly influential group helps shape these recommendations. It's called the Relative Value Scale Update Committee, or RUC. The RUC is managed by the American Medical Association and is composed of representatives from multiple medical specialties. The committee evaluates physician work and provides recommendations to CMS regarding how medical services should be valued. CMS then reviews those recommendations and publishes what is known as the Medicare Physician Fee Schedule. Think of the Physician Fee Schedule as a giant catalog. Every office visit, surgery, imaging interpretation, procedure, consultation, and countless other healthcare services are listed there, along with the RVU values assigned to them. These values ultimately help determine how healthcare services are reimbursed throughout the United States. And that brings us to an important question. How does CMS decide that one service is worth more than another? How is the value of a surgery compared to the value of an office visit? And who sits on the committee making those recommendations? That's exactly what we will discuss in the next episode. This episode is for informational and educational purposes only and does not constitute financial, legal, tax, investment, contract, coding, billing, or medical business advice. Listeners should consult qualified professionals regarding their individual financial, legal, tax, employment, contract, coding, billing, and medical business decisions.